Hello everyone, my name is Dr. Abazar Al-Hassan. I am from Department of Anatomy, Nile University. Today we will talk about the R session about respiratory system and cardiovascular system for pharmacy students and medical laboratory science students. I want this DR to be good and beneficial, and also I hope everyone is fine. Let's start the DR session. We'll start by the respiratory system. This is face. We did sagittal section of the face to see the parts of respiratory system. This sagittal section of the face. The respiratory system composed of nasal cavity, then pharynx, then larynx, then trachea, and lastly the lungs. We'll start by the nasal cavity. This is the nasal cavity composed of nasal vestibule, the outer part of the nasal cavity, composed of olfactory part, which found in the upper part of the nasal cavity for smell, and the other area is called respiratory part for respiration. Then we will move to the pharynx. The pharynx is the area behind the nasal cavity, the oral cavity, and posterior to the larynx. It divided into three parts. Nasopharynx, which area behind the nasal cavity. This is the nasopharynx. Important structure in the nasopharynx is this tube. It's called a Eustachian tube. It has important connection to the ear and to the nasal cavity. Then we move to the oropharynx, the area behind the oral cavity. This is the oropharynx. It has important structure here. This is the palatine tonsil. This is the okay. Then we will move to the third part of the pharynx, which is called hypopharynx or laryngopharynx, which is the area behind the larynx. This is the area for hypopharynx. Okay, then we'll move to the larynx. The larynx is a structure found in the anterior neck. This is the larynx. The structure found in the anterior neck from the C3 cricoid cartilage till C3 hyoid bone till the cricoid cartilage C6. It has many cartilages inside this area. An important structure in the larynx is the vocal cords. This is the true vocal cords. Okay? Then we'll move to the trachea. Trachea is a structure found in the neck also as continuation of the larynx from C6 at level of cricoid cartilage until T3, T4 or T5, which divided into the main bronchus, right and left main bronchus. The trachea composed of cartilaginous part and membranous part. Okay? Here we will talk about the trachea, the two main bronchi, bronchioles, and the alveolar duct, alveolar sac, and the alveoli. Firstly, we'll start by the trachea. This is a trachea composed of two parts, cartilaginous part and membranous part. It starts at the level of C6 and end to divide at the level of the carina to the main bronchi. This is the left main bronchi and this is the right main bronchi at the level of T4 to T5. The right main bronchi is wider, shorter, and more vertical. Then the main bronchi divides into the lower bronchi to supply the lobes, then to the segmental bronchi to supply the segments, and then to the smaller parts which called bronchioles. The bronchioles has several parts, some named as terminal bronchioles and part as respiratory bronchioles. Lastly, regarding the structures of the lung itself, it composed of alveolar ducts, this is the alveolar duct, and alveolar sac, this is the alveolar sac, and lastly the alveoli, this is the alveoli. Okay? Which in this part, the gas exchange which transport of oxygen and carbon dioxide occurs between the alveoli and the capillaries. We will talk here about the lungs. The lungs, it is organ that important in respiration and oxygenation of the blood. The lung has three surfaces, three borders, and has apex in the upper part and base in the lower part. There is important area in the center of the lung called the hilum. This is the hilum of the lung, which the important structure of the lung enters here. Mainly the main bronchus, the arteries, and the veins. There is important question is that how to differentiate between the right and left lung. The right lung has three lobes. This is the upper lobe, middle lobe, and lower lobe. It is divided by two fissures. This is the oblique fissure, and this is the horizontal fissure. This is regarding the right lobe. The left lung has only two lobes. This is the upper lobe and lower lobe, divided by one fissure called the oblique fissure. As I mentioned before, this is the right lung and this is the left lung. Each lung is surrounded by a sac called pleura. This is the thoracic cavity. All this is called thoracic cavity. The thoracic cavity is separated from the abdominal cavity by the diaphragm. This is the diaphragm. The diaphragm is muscular structure that originated from different areas, from the ribs and vertebra. It also related to the liver, as you see. The diaphragm is important to transmit important structures from the thorax to the abdomen. This structure is this opening for inferior vena cava. Then this is the thoracic esophagus, also moves in this area, and also this is the thoracic aorta, transmit from this to the abdomen to be the abdominal aorta. This regarding the diaphragm. After talking about the diaphragm, then we will move to talk about the respiratory muscles. The respiratory muscles compose of the diaphragm as the main respiratory muscles, and then the intercostal muscles and accessory muscles, another accessory muscles. Regarding the intercostal muscles, there are three main intercostal muscles. From external, there is external intercostal muscle. This is external intercostal muscle. Then internally to it is the internal intercostal muscle. This is the internal intercostal muscle. And from the internal side, This is the innermost intercostal muscle group. We will talk about the cardiovascular system in this station. The cardiovascular system, we will talk firstly about the heart, and then we'll move to vascular system, the great vessels. Firstly, the heart is muscular pump that found in the central part of the chest, mainly to the left. Most of the heart found in the left side. The heart has 3 surfaces, 4 chambers, and 3 layers. Right. How to put the heart in the anatomical position? Firstly, this is the pulmonary trunk, and this is the aorta. Pulmonary trunk facing you, and the apex to the left. So this is the anatomical position of the heart. So this is the right side, and this is the left side. So the chambers, firstly, this is the right atrium, this is the right ventricle, this is the left ventricle, and this is the left atrium. Between the right atrium and right ventricle, there is a valve called tricuspid valve. Between the left ventricle and left atrium, there is a valve called mitral valve. Okay. Regarding the right atrium, there is opening important in the right atrium. The superior opening, this opening for the superior vena cava, this superior vena cava, and the inferior opening, this is the inferior opening for the inferior vena cava. These 2 structures important in the great vessels as in vascular system. Then we move to talk about the vascular system. The vascular system, we will begin by the aorta. This is the ascending aorta, this is the arch of the aorta, and this is the descending aorta. The arch of the aorta has 3 branches. This is the pulmonary, this is the brachiocephalic trunk, this is the brachiocephalic trunk, this is the left subclavian artery, this is the left common carotid artery. The brachiocephalic artery divides into 2 divisions. This is the right common carotid, and this is the right subclavian artery. The subclavian artery supplies the upper limb of the body. The common carotid artery supplies the head and neck. Okay? Regarding the venous great vessels and venous drainage, as I mentioned, this is the superior vena cava opening. Superior vena cava drains all upper limb, head and neck vessels, and the inferior vena cava drains the lower limb, abdomen, and the pelvis. After seeing the heart outside the body, we can move to see the heart inside and to see the relation between the heart and the 2 lungs. This is the left lung, this is the right lung, and the heart lies in the center between the 2 lungs. Okay? After removing the lung, we can see the heart inside it. The heart lined by fibrous, lined by sac called pericardium. This sac surrounds the heart and great vessels. Okay? This is the ascending aorta. This is the arch of the aorta. And after removing of the heart, we can see clearly the descending aorta, descending thoracic aorta. The descending thoracic aorta supply the viscera of the thorax, the lungs, the heart, and the esophagus. The descending thoracic aorta pass through opening in the diaphragm to become the abdominal aorta. This is the abdominal aorta. The abdominal aorta supplies the abdomen, the lower limb, and the pelvis. It divides into two terminal branches, right and left common iliac arteries. Each common iliac artery divided into two parts or two divisions. This is the external iliac artery and this is the internal iliac. The external iliac artery supply the lower limb and internal iliac artery supply the pelvic viscera. Okay, thank you. This is the end of the DR about cardiovascular system. Thank you.